On the Scene coverage of ACC 2015 is supported by Effiant.
I'm Peter Block in San Diego at ACC 2015 for On the Scene. With me is Bobby Ye from my old stamping grounds, the Massachusetts General Hospital in Boston. Bobby has been involved in the dual antiplatelet therapy trial, the DAPT trial. I sort of roll my eyes and say, even more about dual antiplatelet therapy, but in fact, now we have some important long-term data. Bobby, tell me about this part of the DAPT trial that is sort of new and interesting and important.
Well, the purpose of this trial was really to look at whether or not the reductions in ischemic endpoints and the increase in bleeding that we saw in the primary results of the DAPT trial were consistent among both patients who presented initially with acute coronary syndromes as well as those who presented with more stable coronary disease without acute coronary syndromes.
And as I look at the data and looked at how this trial was put together, is it true that there's lots of different stents that were used in this trial, or is it more just one stent versus another?
No, any of the FDA-approved drug-eluting stents and also bare metal stents were included in our analysis. We wanted to get a population that captured the full range of stents used in the interventional cardiology community today.
So this is sort of a real-life dual antiplatelet therapy kind of trial. So what did you find? And tell me, well, I guess more importantly, what did you look at to find what you found?
Well, first we looked at whether or not patients with ACS versus those without ACS had similar rates of late bleeding and ischemic complications. We found that in fact ACS patients have higher rates of ischemic complications, but also lower rates of bleeding. The second thing we looked at was whether or not the benefit of 30 months of dual antiplatelet therapy was consistent among ACS patients and non-ACS patients, and in fact they were. Ischemic endpoints were reduced in both groups rather equivalently. The final thing is that bleeding was increased in both groups as well.
So you pay the price of having a little better outcomes for the price of bleeding, fair enough?
Yeah, I think that's a good summary. You know, the magnitude of the ischemic reductions that we see in both groups seem to exceed the benefit, the harm entailed by bleeding. So we think on the whole, on average, for the typical patient enrolled in our study, that is patients who survived a year without bleeding, that the benefits really do outweigh the risks.
Now you kept patients on dual antiplatelet therapy for 30 months, right? Total. So this is a relatively long time and sort of the longest look really at a lot of patients with DAPT. I guess I have to ask you the hard question. If you had an acute coronary syndrome, which I certainly hope you don't, and had a stent put in your LAD tomorrow, how long would you take dual antiplatelet therapy?
You know, I think the shorter answer is I would take it as long as I was tolerating it. Certainly if I had made it through a year without a major bleeding event, I would continue based on the results of this study. Certainly among the ACS population, we know that ACS patients are at higher risk for subsequent ischemic events. I would take that risk of bleeding knowing that most of the bleeds in our study were not fatal bleeds.
Well, dual antiplatelet therapy raises its ugly head again, but now actually very interesting information on long-term outcomes. Sounds to me like dual antiplatelet therapy is probably making a resurgence. We probably ought to do it longer than shorter. And my guess is, candidly, that even patients with myocardial infarction are going to be on two antiplatelets for a long time. So it's interesting. Thank you very much, Bobby. Really appreciate you being here.
Appreciate you having me.